on the items for the joint committee?
None, sir.
Okay, great. So what I'd like to do is invite the CAO representative, Jody Yoxsimer, and the president of the Innovation and Productivity Commission, Todd Sargent, to the table. And before we even get started with you, I really want to take a moment to thank the volunteer commissioners for dedicating hours and hours of their time over the past several months to ensuring that the Innovation Fund really became a success. From establishing eligibility requirements, developing an outreach strategy to employees, scoring criteria, reading through hundreds of proposals, you guys did it all. And it really is a testament to the fact that when Angelinos put their head together, they can make things happen, and that this city is not just run by its elected leaders and appointed leaders and by the folks who work for the city, but it is a city that depends on and is better for all of the volunteers and the commissioners that make this city great. So this was really a spectacular example of folks coming together to do something positive. So let's, with that, I wanted to just let you know how much I appreciate that and how much we all do. Let's move and get an overview of the Innovation Fund and how you selected the proposals before us today.
Certainly. Thank you, Councilmember, and that was a very kind introduction. I know I can speak on behalf of the commissioners that it was our pleasure to kick off this program and get to where we are today, so thank you. The Innovation Fund was introduced as part of the mayor's budget for this fiscal year, as you all well know. We worked through the summer months and into the fall to determine the process and the engagement of the commission, the role of the council, et cetera, and so we worked in joint, and finally that was all passed by council, I believe, in the beginning of November, when we formally kicked off the program. In the very beginning of November, we kicked off the program with a bang, I'd say. We sent out postcards to every city employee and asked them to participate either online through our innovate.lacity.org site or via email. They could send ideas via email or ideas even written on the postcard itself and send it back to the CAO team. And we, beyond our own conservative estimates, we received far more concepts than we ever had any expectation. So we received, at this point, almost 300 concepts, and we were initially, I think we were hoping for 50 good ideas. So very, very good output from our city employees that had just a great variety of ideas, some that were immediately actionable, which you'll see some here. Others that were, as we said when we kicked off the program, nuggets of ideas that we continue to look at and determine how we can operationalize them and make them into great innovations for the city. So at this point, over the last 3 months, December through February, we reviewed and recommend now 8 concepts before this joint committee for review and hopeful recommendation for approval to the council around the innovation considerations. Innovation Fund considerations. I will say some programs were a bit more thought through than others, and so we had, I would call them direct submissions from departments, which were very well thought through, good ROI estimates, good cost estimates, et cetera, and others that took us a little bit more time. To your point about the commissioners themselves being involved in creation of the concepts, or at least getting those ideas to the point where we felt comfortable moving them forward to council. We went through a series of reviews with the commission so that we all felt comfortable with what we were moving forward with. We asked our commissioners to answer 4 key questions around each of the submissions to determine eligibility. First question was how innovative or original the proposal is. Second was, does this program support greater efficiency or increased revenue for the city? Third was, does this program support the priority outcomes of the city, which include a safe, sustainable, prosperous, and well-run city? And then fourth, how feasible and measurable is this project? So on that norming criteria across a 100-point scale, our commissioners took a look at it, and we did require, and I believe every one of these came out with unanimous consent. So we were driving towards full commission support for each of these programs. So with that, I can answer questions about the process or what got us to this point, or we can start walking into the individual proposals themselves.
Great. Yeah, so before we get into the individual proposals, we'll take any questions on the process. And just to emphasize for folks who are out there who have great ideas, this is the beginning, not the end.
Absolutely.
And that the great ideas that are coming, should see what we're doing here, but not feel like they missed out on an opportunity, or even if their own idea didn't get done, that they still can work with commissioners. And the whole idea of this is to attract people to coming up with efficiencies, whether it gets run through this committee or through the department or wherever. So I just wanted to, it's more of a statement than a comment, but I wanted to let you make that same comment because I think that's important for people to hear.
And I would say that the Commission's moved into the sort of second phase of the program, and we're doing aggressive outreach to the department heads themselves and their management teams to workshop ideas. So if there are ideas that are there but not fully ready, we've been reviewing them with the department heads to figure out how they can be turned into more actionable projects for us. And we're pretty successful. I'd say we're about halfway through the departments in terms of outreach. Again, this is all on volunteer time, so we're doing our best.
Right. Any questions from colleagues on process before we start getting into it? Great. Well, thank you very much. So now we're gonna get started with colleagues, we have 8 different ideas, and we're not going to vote on them individually. We're going to vote at the end on the package, but we can talk about them individually and make changes in terms of funding and whatnot. And we can sort of get a consensus as we go, but at the end of the day, it'll be one vote for the package. So with that, I'd like to call up representatives of the fire department to the table to give an overview of their innovation fund proposal.
Good afternoon. Want me to just give a brief overview of the program? Good afternoon. My name is Dr. Mark Eckstein. I'm the Medical Director of Los Angeles Fire Department. Thank you for allowing me to speak here on behalf of this innovative program. The name of our program is a Nurse Practitioner Response Unit. Basically, as everybody here is well aware, our EMS system in Los Angeles is extremely overtaxed. It really comes down to an issue of supply and demand. The number of 911 calls for medical service has climbed year after year, with a shrinking number of resources on the fire department side, overburdened emergency departments, inability of paramedics to unload patients, which leads to longer turnaround times, delayed response times, and ultimately public health and safety may suffer. And the department has continually put more ambulances into service to try to keep pace with the increasing demand for EMS in Los Angeles. But it's obvious to just about everybody that a significant percent of our emergency medical calls are not truly time-critical or life-threatening emergencies. A lot of people call 911 because they don't know where else to turn. It may be lack of education, nowhere else to go, undiagnosed, untreated medical conditions. And this is particularly a particular problem in the underserved communities of the city. The other large issue that's been really taxing the fire department and the EMS system in general in the city is there's a fairly small group of individuals who are habitual users of the 911 system. We call them our EMS system super users. Colloquially, some people refer to these people as frequent flyers, but they are patients. They are users of the system. We've done a comprehensive data analysis of these individuals, and it's a very small percent of individuals who call 911 many, many times a year, some hundreds of times per year. And as you might well imagine, this ties up emergency resources who often respond lights and sirens based on their complaint. These patients often get transported to emergency departments, sometimes more than once within a 24-hour period. And to no one's surprise, when we looked at the data, a significant percent of these patients are homeless. A significant percent of these patients have mental health issues, and others have substance abuse problems or a combination of those. And clearly something had to be done about it. So Innovation Fund really provided us with an outstanding opportunity to be innovative and try to deal with a problem that's been vexing the system. So our EMS system was initially designed to respond to people with life and death medical emergencies. And the Nurse Practitioner Response Unit is really a paradigm shift for the fire department and the City of Los Angeles emergency response system. So the concept in a nutshell is, as you know, our paramedics and firefighters are trained to respond, resuscitate, stabilize, and transport patients, primarily for heart attacks, major trauma, life-threatening medical problems. But an increasing percent of our patients either have low acuity medical problems that are better served in an urgent care setting, or they belong to that small group of patients who are super users who call 911 over and over and over again, and it's really a proverbial revolving door. We're not solving these patients' problems. We're not getting them into a medical home for primary care. We're not addressing the underlying issues of why they keep needing our services. So the concept that we've put forth, and we were asking for your support, is a nurse practitioner response unit. So nurse practitioners who are taking on a greater and greater role in our healthcare system as we try to shift to a primary care model in the United States are trained or experts in urgent care. So the concept of the proposal really is to hire a nurse practitioner who has expertise in emergency medicine and urgent care, put them on a reserve ambulance with an EMS captain, have medical equipment in the back of the ambulance that can provide very timely point-of-care testing for rapid diagnostics, and the whole goal of the program is a treat-and-release model. So rather than transport every one of these patients to the hospital for low-acuity complaints or transport our super users over and over and over again without actually identifying and mitigating their problems, the nurse practitioner response unit will be in a treat-and-release modality. They'll be able to quickly identify and diagnose the patient's problems. They could write prescriptions. They could provide wound care. They could provide clinic follow-up appointments. They could assign these patients into medical homes and therefore free up our paramedics and firefighters to do real emergency work and also not deal with the long turnaround times of the hospitals. The other subset of patients, the super users I alluded to, the nurse practitioner response unit will make scheduled visits to our super users, and we have a very robust database of who these individuals are, and work with various stakeholders throughout the city and county in terms of public health, mental health, detox, community outreach, programs for the homeless, to try to get these people the help that they need, which will exponentially free up our resources to take care of time-critical medical problems.
It sounds like a fantastic idea. I know it's been kicking around for a while, and it's great that the Innovation Fund is taking this up as an idea. How are we going to measure the success of this program?
Excellent question. So we have a number of metrics we will measure to determine our success. We look to measure how many patients the nurse practitioner response unit responds to on a daily basis, and these are upon request of ambulances or firefighters on scene who believe the patient doesn't need transport to the emergency department, and we'll have very specific clinical parameters. So how many patients they respond to per day, how many patients ultimately are triaged and treated out of the system that don't require subsequent transport to a hospital, the nature of the patient's complaints, how long they spend with each patient. We're going to do patient follow-ups at 24 hours to make sure that it's safe and there's no secondary need to go call 911 for a medical emergency. And in terms of the other group of patients, the super users, the most important metric will be the decreased 911 utilization for these patients based upon their proactive interventions. So we have an individual, for example, who's called 911 300 times in the last year, and there's been some cities that have had very significant success with different models in trying to reach out to get these patients the help that they need. So we're going to measure kind of before and after what is their rate of 911 utilization after intervention with the nurse practitioner response unit.
I have a suspicion that this one will really pay for itself over time, manyfold. But that's the point of doing a pilot, is to see that and measure that and make that happen. Now, the pilot, have you figured out where it would take place?
That's an excellent question. So we haven't pinned it down precisely. We wanted to keep a kind of a broad-based 35,000-foot view at this point in terms of get the nurse practitioner on board, determine the medical equipment we need, work at our field policies and procedures. So we are flexible in terms of the neighborhood. Obviously, we want to target an underserved area where we have a high percentage of patients whom would be better served in an urgent care setting and need to get into primary care or medical care home than constantly go into the ER for unscheduled visits, and also where there's a preponderance of our so-called EMS super users. So we've thought about Hollywood, we've thought about Van Nuys, but the particular neighborhood, there's a number of neighborhoods that would work, and certainly we're open to suggestions. I know there's obviously a number of political ramifications and so forth, but because it's a 6-month pilot right now, I'm absolutely convinced the program will demonstrate safety and efficacy, which is what it's designed to do, and will have a significant impact on whatever neighborhood is ultimately determined to be the area we will pilot this program.
And currently, there's a gap in the funding because it's. I guess you guys were initially asking for 245,000. The recommendation that's coming to us is for 147,000. How is the fire department going to make that remaining gap of 98,000?
So we're, trying to do this, on a bare bones budget, obviously, with the Help to Innovation Fund. We're also trying to solicit donations from non-governmental agencies. Obviously, June could also assist with the budgetary issues. So we are looking at outside funding as well. We want to get this program launched and make it successful. But certainly, June has a lot more insight as to the actual budget.
Can I just speak really quickly from the Commission perspective? So the initial request was for a 12-month pilot. And so upon further review of the Commission, we felt that a 6-month pilot at 60% of the original request would be appropriate for this. We would be able to substantially determine success of the program within a 6-month period.
Is there anything lost in going from 12 months to 6 months in terms of the? I'll tell you, I'm tempted to fund it at the full amount. That's my temptation.
Thank you. Well, you'll certainly, the larger the sample size, the better we'll be able to demonstrate the effectiveness of the program. So certainly the super users, if we're able to get 10 patients plugged in with the services they need, and that would free up literally hundreds of emergency responses of fire engines and ambulances. That's a great direct benefit to public safety. In terms of other patients, in terms of treat and release, obviously it will decrease wall time, increase ambulance availability. But obviously, the longer the program is in progress, the greater the numbers, the greater the sample size, will be better able to justify that it will pay for itself and have a measurable benefit on public safety in the city of Los Angeles.
Did you want to add?
Yes, sir. For the council members who have been with the city for a very long period of time, I think you all recognize that when we implement a pilot project, it takes a little bit of time in order to get it rolling. From a practical standpoint, I'm very concerned about a 6-month period, even though we have the greatest confidence in Dr. Eckstein and his ability to be able to implement this program. From a practical standpoint, I'm very concerned that we really only will probably likely have a 3-month pilot program for which the 147,000 is going to fund. The fire chief agrees that the longer the period of time, in order for the program to show itself in terms of the potential success, that we can garner, the better off we are. We absolutely agree with the committee chair that the full funding from the fund would be of greatest benefit to the department. Arguably, we could ask for the difference within next year's budget, but the history of the fire department in terms of our ability to be able to be fully funded, which in the past several years, has been very difficult. Arguably, again, 85,000 seems like a de minimis amount, but for a department that the current year we have a deficit of $22 million, $85,000 for us, is very important. So if there is available funding within the Innovation Fund, we would ask that the committee support the chair's suggestion that the entire $245,000 that was originally requested be funded to the department.
And this program truly is a potential to be a game changer in how we do business and taking care of EMS and delivery EMS in the city of Los Angeles, because the way we're going now, it's just not sustainable. We put more ambulances out there, we transport more patients, paramedics are on the wall in the EDs, and this is time to really evaluate how we do business and provide a better service to our patients and do it more efficiently and more cost effectively.
I think I'm going to make that recommendation. Before I make any recommendations, I want to hear from colleagues if you have any questions or comments. But that's the direction I'm headed at the moment. So,
Thank you. Thank you. This is an interesting proposal. I like Mr. Blumenfield, I would be supportive of doing the full year. I agree with Ms. Gibson that with the sort of rollout and startup time and getting the kinks worked out, you'd lose a few months there. So I think doing a full year would be important. Thank you for specifically addressing the wall time issue. It's something we've been wrestling with in Public Safety Committee for a while. It's an issue near and dear to Mr. Englander's heart. Can you talk just a little bit more about what the benefit would be in resolving that issue, or maybe for some of the folks who aren't familiar with what the wall time issue is, what it is, and how this helps it?
Certainly. Thank you, sir. So we historically have transported for the last few years, just in terms of the numbers, about 550 patients a day, and we're now running about 640, 650 patients a day. So that's about a 20% increase. The emergency departments are busier. We have an increased number of inpatient beds in the hospitals. They've actually gone down. So what happens now is paramedics transport patients, and they're stable, but they're not well enough to go to the waiting room, but they're not sick enough to get the last open bed in the emergency department. So what happens is our paramedics go into the emergency department and they stand on the wall basically with their patient until a gurney, a bed opens up in that emergency department. So we've tracked this data for many years. The accuracy of the data is somewhat debatable, but clearly it has a significant adverse impact on the availability of ambulances. So the potential tragedy is we have a time-critical emergency in a neighborhood, and those paramedics are not available to respond because they're on the wall in a hospital waiting to transfer care. So one of the benefits of this program is paramedics get on scene of a patient, they meet the criteria, the clinical criteria we set forth. It's a low acuity patient. They call out the nurse practitioner response unit in that particular battalion or that neighborhood they're located in. The nurse practitioner response unit responds. Those paramedics are free. They go available immediately. So the whole concept of transport for a low acuity patient and then perhaps taking the wall for hours is eliminated with this program. And so that's a direct benefit to the public in terms of greater availability of ambulances. So this is, and obviously the net impact citywide obviously is dependent on how many months the program goes and how many units we have in the city. So as a pilot program, we're going to see some benefit, but obviously the longer the pilot goes, the greater the measurable impact citywide on wall time.
Thank you. I'd also want to suggest, as you look at potential pilot areas, I'd ask you to consider Venice as one of the areas. Station 63 in Venice, depending on who you talk to there in the station, anywhere between 70 or more than 80% of the calls that they get are paramedic calls for transients in Venice. The vast majority of the calls they get. From some of how you were describing this, that might be an interesting sample. So I'd like you to consider Venice as a possibility. The other examples or the other potentials you brought up also certainly make a hell of a lot of sense. I'd ask that when you start thinking about which one to use, if you dig down deeper than sort of the battalion chief level to get an assessment and actually talk to some of the captains at the individual stations to get a real sort of granular on-the-ground sense of what's happening in that station to see if it sort of suits what you're looking for the pilot.
Yes, sir. If I might add, thank you for your points. The only caveat is, just like we initially were thinking about the downtown area, I think people would agree if the population of the super users are predominantly homeless, that's a particularly challenging population to get really definitive care. So out of the gate, we were probably shying away from an area where the predominant percent of our super users are homeless because it's a very difficult population to really get out of the EMS system and get them the care that they need. And we've met with other cities that have some different areas of success with programs similar to these. So clearly Venice and downtown, we know there's a high percent of homeless people. That's part of the program in terms of working with the other stakeholders in the city and the county.
Okay, well then look at Pacific Palisades. Thank you, Mr. Chair.
Thank you.
Yeah, thank you. I also want to echo Bob's comments on just thanking the Commission for your incredible work here, volunteering your expertise for free to make the systems in the city work better or create new ones so the city can then work better. I really, really want to commend you for that. We can't do anything without volunteerism, so thank you. And also to you, Dr. Eckstein, for your work on this. And just a couple of questions I have is that, according to the report, there are 2,049 calls to 911. That's per year? That are from the super users?
From the super users, yes, sir.
So what percentage is that, roughly, of all calls?
I believe the super users is something like 1% of patients make up something like 10% of the calls. I mean, we looked at, and the different definitions of what constitutes a super user. But again, we're looking at individuals who call several hundred times per year.
So that's the top end of the spectrum.
Yes,
the
sir.
lower end is what, 10?
A lot of other communities use the definition of 5 or more times per year. But we have individuals where there's a huge impact to the field. We're talking about dozens of times, hundreds certainly. But if that's someone who calls 200 times a year, and we get that person help they need, think about, and those 200 responses, the 200 incidents, often it's an engine and an ambulance. So that can maybe 400 responses of emergency apparatus per year that might be eliminated.
And that accompanies 1,375 ambulance transports.
Yes,
The
sir.
super users alone.
Yes, sir.
And so, along those lines, what is the staffing commitment or so-called wall time when a super user is taken and they're just waiting around? How many staff members particularly or typically are there just kind of waiting around until the super user is dismissed from the hospital?
So to be clear, so the nurse practitioner response unit would never transport.
Mm-hmm.
So the goal is to treat and release.
Oh, I know that.
So
In terms of currently,
okay, so
the way it works.
interesting question. So it really depends. A significant percent of our super users have substance abuse issues, particularly alcoholism. And if they are intoxicated, most of the time they need to be transported. And because these individuals are a fall risk, most hospital emergency departments will not let these individuals sit in a chair in the waiting room. So it's it's really insult to injury. So we have paramedics watching someone who's intoxicated on a gurney, sometimes for hours, till they get a bed. And then the revolving door, the patient sobers up, walks out of the ER, may get drunk again, may fall down. Sometimes they transport the same patients multiple times in a shift. So it really depends. If it's someone who has a mental health issue or a chronic medical problem, sometimes they could transport to the ED, deliver care, and they're right out. So it really depends on how busy the emergency department is, and it depends on the complaint of the patient. If the patient's not ambulatory or a fall risk, there's a greater likelihood that our paramedics will have to be on the wall waiting for a bed. If the patient doesn't meet those criteria, there's a greater chance that they'll be triaged. They'll triage the patient right to the waiting room. Our folks will be free to go back to the field to the next call.
And so that locks up the vehicle and the paramedic.
That's correct,
The whole
sir.
time they're just waiting.
Right, so 2 paramedics and the ambulance out of service until they get a bed.
How oftentimes do you have to have a public safety official, like a police officer, there as well? Is that,
At the hospital?
yeah?
That doesn't happen. Most of the hospitals have their own security, so that's not an issue. And then when we will send an EMS captain to try to free get our people out of the ERs. It's a very complex issue. It really comes down to supply and demand. And we're working on some other innovative ideas to try to mitigate that problem, which is not unique to Los Angeles. And whether we take them or not, the patients end up in the emergency department, but there's too few inpatient beds. And then so the ED is holding admitted patients. There's no room for new patients, and then our folks are on the wall. And I think the community assumes paramedics get right back out and they're available for the next call, but as you know, that's not the case right now very often.
So this nurse practitioner program, it's also in Mesa, Arizona, and other cities?
Yes, sir. So Mesa, Arizona is probably the first program. There's a lot of cities have tried to tackle some of these issues with community practice paramedics. I felt the nurse practitioner program, which in our proposed program does emulate the Mesa, Arizona model, but in an urban environment, I think is a better fit because, again, the nurse practitioner, they're specifically trained to deal with low acuity patients as opposed to taking a firefighter paramedic who's really only trained to deal with the life and death emergencies and try to make him or her to train them to a level to deal with urgent care. So it's the low acuity patient or the patient with the social issues who are super users. We have nurse practitioners who that's what they do professionally for a living and that's what they're trained to do, which is a much more seamless transition than getting our paramedics to do so, who are really trained for firefighting and basically resuscitation.
And so how long has it been in effect in Mesa? It's not just a pilot, it's the way they do it now.
Yes, sir. It's been in effect for a few years. The data they have is limited because of the relatively small size of the low population there. I've met with their medical director there. He's come out and met with us. I think they're looking at starting a similar program in the city of Anaheim with Anaheim Fire Department. I think the potential impact in the city of Los Angeles is absolutely huge. So obviously the scope of a pilot is limited, but I think we'll be able to show unequivocally and quantifiably a better service to our patients, increased efficiency and cost savings to the city. And this is something down the line we might be able to even, bill for down the line. But right now the goal is safety and efficacy.
I'm fully supportive of this as well and for the full year, and I just think that you should figure out where the highest concentration of calls from super users are coming from and just go there and do it. That's what I would suggest.
Thank you.
Thank you.
Seeing no additional questions, Mr. Parks,
I only have 10. So.
please.
Now, I was wondering, how much money is in the fund?
$1 million.
The other thing I was wondering about is that in looking at this, have we done anything to educate the public? I know every jurisdiction has a different 911 policy. Some you just call for city services, some for emergency. Do we have any idea how many of these super users are using the 911 for what other cities basically reflect that you use it for everything in the city?
Interesting question. Some cities have had mixed results at best with public education campaigns in terms of proper utilization of 911. And paradoxically, some systems where they've tried the public outreach, 911 volume actually went up. Most of these patients, in terms of super users, are patients who have complex, combination of social issues, substance abuse, mental health issues, something paramedics can't fix in the field, and the emergency departments aren't really equipped to fit. It's a long-term planning, medical homes and referrals and not in a vacuum with other stakeholders and groups. So this is I don't know how best to answer the question. We can't triage these patients out at the point of dispatch, and the paramedics can't triage them out of the system in the field either, because otherwise they'll just keep calling. If it appears to be overuse due to malice, malicious abuse of 911, we do dispatch an EMS captain to the scene, who will then partner with LAPD, and we've have had some of these people arrested on occasion. In my experience, and I've been with the department almost 20 years, and I've been in the system here in 25 years, I would say that the malicious 911 abusers account for a very small percentage of our super users. The overwhelming majority of patients with a multitude of mental health, social, and medical problems.
Okay. The other thing I was wondering is the goal of the program not to transport or to get the transport relieved more quickly?
It's both, sir. The goal of the program is to provide the patients with the care they need on scene within 15 minutes. A very quick, focused medical assessment by the nurse practitioner. Some point-of-care testing is indicated in the back of the ambulance. Prescriptions if needed, wound care if needed, clinic appointments, assign them to a medical home, and free up the ambulance immediately and not have to transport these patients. And hopefully, next time they have a similar occurrence, they have a medical home and a clinic appointment. They don't have to call the 911 system because they feel like they have nowhere else to go. So there's also downstream effects as well.
Because you're trying to deal with both. So if they get to the hospital, you're trying to reduce the amount of time that paramedics wait.
Yes, sir. The longest time metric of a EMS call is the transport component. And as Councilmember O'Farrell mentioned, oftentimes it's difficult to get out of the hospital because of the open bed, and that could take sometimes hours. But even if the hospital is wide open, it's the transport component is the longest piece of an EMS call. The average EMS call for paramedics is about an hour. 2/3 of that is the transport component.
When you were developing the program, any thought on having the nurse practitioner assigned to the facility where the paramedics arrive, so that they can what I was thinking is whether they would deal with multiple cases, because it sounds like if they're at the facility, they can relieve one paramedic to go back, but you might have 5 paramedic teams at the hospital. Is there any thought on how, if they were assigned to the hospital facility, they could deal with multiple reliefs?
Yes, interesting question. So we've had some discussions about having some of our personnel or something like a nurse practitioner in the ER to free our people up. I think the problem is that we're basically having city staff, fire department staff, take the place of personnel that the hospital should be providing. We are working up right now some new plans to try to get our people out of the field in terms of having an EMS captain do a secondary review of the stability of the patient, and then have 1-2 firefighter EMTs watch up to 3 patients at a time and let 2 ambulances get back out in the field. But to have a nurse practitioner with that level of clinical training as an autonomous practitioner watch the patients in the hallways is not a good use of their expertise. Most of the time, these aren't patients on monitors where we're having chest pain. These are patients who just need a bed, who don't need to be monitored. And basically, the hospitals could just provide a nursing attendant to watch these patients. So nurse practice, probably not the best use of an NP. I think having the NP respond in the field with an EMS captain, I think, would be the best use. And I'm confident our pilot program will demonstrate that.
But between the two of them, which is a better use, the paramedic or the nurse practitioner, if you were trying to relieve them?
I would say probably door number 3, quite frankly, would be someone with a lot less training. You don't need a nurse practitioner training and the salary that goes with that. It's really someone to just watch a patient, which is akin to a nursing attendant at a hospital. It's not a nurse. It could be a nurse's aide, for example, or an LVN. But a nurse practitioner is an autonomous clinician that prescribes medications, treats patients independently. They're becoming basically the backbone of primary care around the country. So the suggestion or the concept of having a fire department or city employee relieve our people in the ED certainly is an interesting concept. If we were to pursue that, I would say an NP is way overtrained to fill that role.
But I mean, the thing is if you relieve both, if you had some person or position that relieved either one of them, you'd get better use of them in their primary task, as opposed to just having either one of those skilled people sitting at the hospital.
That's certainly true, but I think our goal of this program is to take it a step further and not have the transport in the first place.
Okay, so the goal, that's what I asked initially, the goal really is not the transport.
Yes, sir. So it's a treat and release, and the diagnostic capabilities that the nurse practitioner response unit will have in the field greatly exceeds that of an ambulance because the scope of practice of an NP greatly exceeds that of a paramedic. And with modern technology and point-of-care testing, it's almost like a small ER on wheels. We want to keep it to a maximum of 15-minute evaluation, and it's a treat and release modality as opposed to just treat and transport everybody.
You may have answered this earlier, but what has the department done as it relates to those super users before you get into this pilot? What have you done to somewhat go out and educate the people that are using the system over and over again?
Excellent question. So we've had several meetings with LAPD's Mental Evaluation Unit, MEU. As you know, they have a number of both uniformed officers with extra training and civilians who both are mental health experts, public health experts. So we've met with them. We've also met with the District Attorney Lacey has a group they put together, task force. We've attended some of those meetings, and we've established a very robust database. And again, we have EMS captains come out upon request of field resources for some of our so-called 911 abusers. But beyond that, we haven't really had anything really in place to try to mitigate that next 911 call. It's not a question of say don't call, but we haven't addressed the needs of these individuals. It's a combination, typically social issues, substance abuse, mental health issues. So unless we have an entity in the fire department to go out with scheduled visits and work with all the stakeholders out there now to try to get these people the help they need, they're going to default into the system. And some of these people don't call for themselves. Often would-be Good Samaritans call when they see someone on the street. So it's really multifactorial, but I think being proactive with these individuals will not only help get them the help they need, but it'll free our resources up exponentially.
Or is it your perception that many of these people do not have access to medical care? Is that they're using paramedics' emergency room for their health care?
They either have no access or they don't know where to go. Many of these people have undiagnosed or undertreated medical problems, and they don't know where to turn because of the constellation of the other issues, mental health and substance abuse. So the default is they just call 911, and the emergency department addresses their acute problem, but it doesn't address the root cause of their frequent use of the 911 and EMS system, which is getting control of their chronic health conditions, getting them plugged into a medical home for primary care, detox, mental health. So, it primarily helps the patient, but when you're talking about one individual who calls 911 hundreds of times a year, think about 500 responses of lights and sirens of fire engines and ambulances. If that one individual is out of the system by getting them help with the NPRU, up to 500 fewer emergency responses from the fire department, one individual alone, and that's huge. That's absolutely huge.
The other thing I was wondering about is that is the long-term savings looking at possibly this program reducing the number of paramedics we need, or do they go hand in hand to where the workload reduces and we keep building the nurse practitioner program, or how does that work?
No, I'm glad you asked that question, sir. So I don't in any way see this eventually reducing the number of paramedics. We're trying to right now get a proper balance between EMTs and paramedics. Clearly, and that's along with the database we have with fire.
The wrong term, whatever the
long term.
Picture.
The idea is to have our paramedics respond to patients who need paramedics, heart attack, shortness of breath, major trauma, And then EMTs take patients to the hospital who don't need paramedics, but, for example, have they broke their leg or something like that, have a head injury. But the concept now, we're becoming a taxi service, for lack of a better term, for patients who are better served out of the EMS and emergency medicine milieu is the goal of the program. So I don't see this as replacing any of our field resources. It's freeing up our resources who are grossly overtaxed now to take care of real life and death emergencies and not be tied up with urgent care and chronic medical conditions.
And then the final question I was asking the commission, the one thing I was surprised at in reading this is I always thought when we dealt with productivity that we were looking for funding things that were a one-time shot as opposed to a multi-year personnel resource. And I was wondering, is that something new or changed as it relates to the prior discussions?
No, you're correct that this would be a now 12-month, 6 to 12-month pilot program. At that point, it would be considered, I think, for annual funding through the general fund. So that would be the position of the commission. This is a one-time pilot program funded through the Innovation Fund.
I understand that, but I said I was just wondering, is that new for this group of proposals?
That they would be one-time.
That you would be funding personnel, ongoing personnel resources. Either the budget's going to absorb them, or just wondering. Because what I recall is that we used to have,
correct,
that it was a one-for-one. You bought a piece of equipment.
Yes.
You did something that was a one-time deal.
So what's new for this program, Jody Oxheimer with the CAO, is the ability to test new ideas and to even fail. So the real spirit of the Innovation Fund is to even be innovative. The Innovation Fund itself is a pilot project, and so a pilot program, and so it's trying a number of new things, including funding items that, if this pilot is successful, there may be opportunities to expand the program. There may be opportunities to find faster paramedic time, and then there would be opportunities to consider the larger budget implications in future years. But the one-time limitation that was formerly associated with the Productivity Fund doesn't apply in those terms the way that it used to.
Okay, thank you.
Thank you, Mr. Parks. So it's going to be my recommendation that we're going to increase the Innovation Fund allocation by $98,000 so that we fund the pilot for 1 year. And obviously, then it goes into the budget process and whatnot. So that's the recommendation. As I mentioned before, we'll do a vote at the end. So the next one we're going to take, normally I like to go in chronological order, but one of my colleagues has to leave and ask that we jump to number 7.
Thank you very much, sir.
So we're going to jump to number 7 for now, which has to do with the LAPD online police reports. So I'd like to invite Delilah Boucher, the IDEA applicant, to the table, and Maggie Goodrich, representing LAPD. And then after this, we'll jump back to number 2 and continue in the usual chronological order. So, Ms. Boucher, could you tell the committee a little bit about why you made this proposal and how it came about?
Delilah Boucher. Normally I would say Office of the CEO, but I guess today I'm here as the applicant. Back in October and November, outside of work, I came across 2 incidents where I needed to file a police report. And the amount of time it took for me to get these reports, one was identity theft and one was a hit and run to my vehicle. It was so time consuming because they kept requiring me to come back with more information. And when I came home and I expressed to my husband, with all my kids and everything that I have to do, well, 3 kids, I say all, everything that I have to do, if there was a simpler way to do this, maybe it would be possible. And my husband, who's an existing police officer, said, yeah, not only if we could do that, but he was, I think at the time, the U-boat, which is an officer who's assigned the vehicle who just goes around and writes report in his area. He's like, not only if we could do that, but if we could do cell phones and vandalism and custody disputes, and he started coming off with a list of everything that was too much detail for me. Needless to say, when I went to pick up the report, the lieutenant at the time said, you know, too bad this didn't happen a month later, because next week, which was December 4th, we're going live with a SORTS program, which is a sheriff online reporting system. He said, you could have just submitted online and saved yourself the time. And I said, well, geez, you know, maybe next time I'll think about that. So I said, can you give me information? And he ended up sending me an email. And then I want to say the following week after, we get this email from my boss, saying the mayor's innovation system is soliciting ideas, and I said, there you go. It must have been perfect timing. So I started having discussions with my husband, because prior to working in the CAO, I used to write reports. I was a traffic officer and a senior traffic supervisor where we used to do stolen vehicle recoveries for LAPD, which were not, they were to get towed, so the vehicle we just came across was stolen. Or prior to that, when I was in the Marine Corps, I was with the Provost Marshal, and we used to always respond to calls where someone would just want to do a vandalism report. So I submitted that as part of the process, and I contacted our counterparts in the Sheriff's Department and my husband. I submitted what I can to then come up to this commission and say, if we could fund an idea with all these ideas, because we're a little behind. I mean, Seattle does it, Houston does it, Arizona, Phoenix does it, Arcadia does it, Montebello does it, I think Alhambra does it. So we're a little behind. If we could do that, then maybe people like me who have 3 kids in 6 different sports could just save a half hour or two. That's a very valuable half hour. And parallel to this process, I found out that the LAPD is in the process. They did solicit a RFP, which I'm sure she's going to speak about. Although I don't know what stages they are development-wise to know whether or not it's consisting of the same types of crimes that might be what I'm gearing to. They are open to discussion for our input. And I know there was discussion for metrics, so the county, our counterparts of the county did send us, if you were to say, well, how would we measure this? Because I think there was some discussion, well, now with the ease of submitting it online, we're going to have more crime out there. But I think for the county and for other cities that we did a little bit of research, it was dollars. How much time are we saving for an online report that would typically require a officer or a deputy to go out there and do that? And they provided me with a template, which I just got, if you're interested on what we would look at. But they gave me a little history that might be beneficial to LAPD as we go along this process. So I'll leave that open for LAPD's discussion, since I'm not here as the CAO. So there you go.
Ms. Goodrich, do you want to-
Thank you. Yes, so we agree it's a great idea. It was actually on Chief Beck's list of priorities last year in 2014 for one of the projects he wanted to get off the ground. There was also a council motion some time ago about the idea as well. So we released an RFP to select a vendor. We've made that selection, and we actually selected the same vendor that the sheriffs went with, so we'll be able to leverage the experience that they have in implementing the system. We've already reached out to the group of the sheriffs that have done the implementation to get their lessons learned and understand what that process looked like. So we're close to having a negotiated contract out of that RFP process to bring to the Board of Police Commissioners and then to City Council for approval. The statement of work's all set. We're just waiting on the attorneys to hammer out the final T's and C's, basically, and then that will go to Commission and then Council for approval. We're creating a working group with the Office of Operations. I'm actually submitting her husband's name to the Office of Operations to see if maybe, I know he's on patrol, but maybe we can get him in for a couple of meetings to talk through the ideas. The vendor that we've selected basically allows for a whole host of different types of reports to be filed online. So it'll be up to the folks in operations to decide where do we want to start, what types of reports do we want to accept online, and then probably grow from that starting point. The idea being that we would start with things that don't necessarily require a face-to-face interaction with an officer. There's certain types of reports that are typically filed by someone having to come into a police station. It doesn't rise to the level of a 911 emergency, but they have to come in, they have to stand in line at the front desk, they interact with the officer, they fill out some paperwork, and there is that back and forth that Ms. Pache described. And so to hopefully eliminate that and allow that to be an online process will hopefully provide some great efficiency.
Clearly a great idea. Question, if the LAPD is already moving in that direction through the RFP, why do they need the Innovation Fund?
So my understanding is the Innovation Fund would contribute the funding for the maintenance basically on the system that would be required in next fiscal year. There's a $60,000 a year maintenance fee on the system itself. So my understanding is that's what it would be put toward.
So if we didn't put any money into it, what would happen?
you will then see my general fund budget request for the $60,000 in maintenance for next fiscal year in the budget process.
Okay, Mr. Farrell, I know you're on the time schedule, so please.
Thank you. I'm the one who has to leave. I have at 4 o'clock. Thank you so much. I think this is a great program as well, and I hear about this a lot in the district. And I'm just curious, as you're describing this great idea, at what percentage it may increase reporting of low-level crime, because I think it would shoot up a little bit, which isn't a bad thing. Do you have any thoughts on that?
We've reached out to some other agencies to understand the impact of that. We don't have those results yet. That's one of the discussions we've had, though, and the way we look at it is it may not necessarily increase crime, but it may increase the reporting of, right. But you're right, it is lower level type of incidents, incident reports, more likely than sort of traditional crime reports.
But if it could also help on deployment choices. It could help
Absolutely.
identify hot spots where these low-level crimes are happening. So I think it could positively influence addressing crime. So I think it holds great promise.
Absolutely, can help us with deployment and can also help shave down some of the time that we spend deploying officers to a home or to discuss this low-level crime, to gather additional evidence. If some of that can be submitted online, then the way we patrol officers, I think, can be impacted as well.
And we're talking about it going citywide, not a pilot.
Correct.
Yeah. Great.
Yes, citywide.
Thank you. Ellie? Mark?
Yes. I was just wondering, what does the sheriff use as a criteria for the reporting?
I'm not sure. We've reached out to them to talk through how they develop the process, but I think they only accept a couple types of reports to start off.
You haven't created a criteria for the city yet?
Correct.
Okay.
That's what the working group will do, is create the criteria.
I have a little of the information. The committee established non-workable misdemeanor crimes that did not result in an injury, did not involve a weapon, does not involve a hate crime. They also have 6 report types: lost stolen cell phone, that were deemed non-violent by this committee; lost property, theft of less than $950, theft from unlocked vehicles, and vandalism at less than an amount, and supplemental loss reports. I also have an attachment if you want to take a look at specifically what their crime reporting looks like, the reports generated from the system.
And may I add, just from a commission perspective, we actually looked at the criteria for the Sheriff's Department, LA Sheriff's Department, and we made our determination based off of those types of criteria, which was pretty much mirrored what was stated here.
And that's in line with the initial list that we've discussed internally at the department, but we don't have anything finalized yet.
Thank you.
Great proposal. Glad to see it. Long overdue. Just curious if these online reports are things that officers in the field will have access to, or at what point we'll get to the ability for officers in the field to file their reports from the field.
So these reports will come in and be accessed either, that part of the working group discussion is, will it come into a particular station, and will it come into a central group, maybe out of the Office of Operations? So that's one of the things up for discussion. In terms of officers being able to file their reports online, so we're doing a couple things in that regard. One is in the budget request for next fiscal year, we've asked for funding to procure a new records management system. At the moment, our records management system is, I don't think you can even really call a records management system. It's a 25 plus, maybe 30-year old mainframe data repository, basically. That makes it very difficult, even if we were to put a mobile platform out there and allow officers to fill those reports out. Mainframe's not so good at accepting that data. So one is to actually begin the replacement of that mainframe application. So it would replace not only our crime and arrest system, it would also replace our property and evidence booking system, as well as our booking system for the jail. The idea is to get rid of those 3 mainframe applications, probably some other ancillary, and get a platform that can accept that type of data in a modern format and get away, do away with COBOL. So the other thing we're doing is, while that's going to be obviously a long, multi-year, expensive effort, while we're doing that, what we're also doing is we've convened a working group within the department from various areas in the department, patrol, detectives, et cetera, to talk about what are the projects that we can do in parallel that may not necessarily fit into a traditional records management system. Because all sort of COTS product records management systems will come with sort of standard modules that will be off the shelf that we'll want to use. But there are other types of reporting that can be done outside of that and then integrate easily into those COTS products. So one of the things we're looking at, for example, is developing a mobile FI card so that officers are no longer handwriting those things. Looking at, can we use mobile devices to actually capture the code on the back of your ID, populate your information so that officers aren't having to transcribe all of that, and then ultimately take that information and also populate the other reports that officers have to fill out in the field. So that's all on the roadmap.
Good stuff. Glad to hear it. Thank you.
Great. Well, did another comment, Mr. Parks?
No.
Well, they're a little confused with the sort of budget versus innovation fund. I'm kind of and because you're asking for 50 on this versus the 60 that it costs. And I'm kind of the school it should be all or nothing. Either we make it a budget item next year, and which I would firmly support, or we make it an innovation item, which I completely respect that the committee has identified it. And so my temptation is to recommend the full 60 to cover the program. But
I can give you some background. So keep in mind that the submission came independent of the department. The department did not submit the concept. Right. So when we reviewed it and approved it, we estimated it to be a $50,000 project. When we went then did the due diligence with LAPD, we found that it was a process in works and that it was estimated at $60,000. I don't think that the commission would be object to changing the allocation to $60,000 though, based on feedback.
Okay, then it's going to be my recommendation that we move and recommend the $60,000 to cover the program. So thank you both very much. Thank you. Great coming up with that idea. And now we'll go back to chronology and go to item number 2, BOE 3D printed architecture model making for $10,000. We have representatives from BOE. Please come to the table to give an overview of their project. You brought show and tell.
Yes.
Props are always good.
Go ahead. Good afternoon. My name is Mark Nakata. I'm a senior management analyst with the Bureau of Engineering Architectural Division. I brought my supervisor, Mahmoud Kram, today. He's the principal architect for the Bureau of Engineering. Our mission is to design and to project manage public buildings and open spaces for various city departments and client agencies, including council offices. We do recreation and parks projects, police facilities, and maintenance yards, and so forth. One of the techniques that our architectural designers utilize in the design process is making physical models, both for design charrettes and for ultimately for public presentations, such as going before the Cultural Affairs Board, going to your community to present our design concepts to get feedback and response from community members. The traditional way that we have been building these models is by hand, using physical models such as balsa wood, cardboard, whatever we could scrounge around in the office and glue together before the meeting is due. We'll put something together real quickly and present it to the community. If we were in the private sector or private practice, they have staff that's dedicated to model making. Some firms are as large as our entire staff in the architectural division. They have machine shops, they have wood shops, they have all the tools necessary to outdo us in the production of physical models for architectural design. However, with the innovation of 3D printing technology, where the price is rapidly declining, the options are openly available, and the price is rapidly coming down, we're able to integrate what we're already doing in the design process, which is using building information modeling technology, BIM, through our software process, which basically models architectural projects using a 3D software, and then converting the 3D computer file into a readable format for 3D printing, which will produce objects such as this. So what we're asking for is a relatively modest funding from the Innovation Fund of $10,000, which we believe we could buy a quality prosumer 3D printer, which will enable Mahmood staff to print out the models as they're working out on their BIM designs, using the various iterations for both the design charrettes as well as actually presenting these finished products to the communities. In terms of how we would measure the success after we acquire such a 3D printer, we would like to have 10 members of our staff to be versed on how to produce these models, and we would like to at least have 1 or 2 projects actually utilize the technology as part of the design process and as well as the public presentation process. And I'd just like to thank the Commission and Council, because I haven't been so excited since my middle school science fair and this, just got me a great opportunity. The models that I printed out are from a 3D printer that I purchased on my own on eBay from China. As you can see, they're not perfect, but I think the market is ready for professionals to actually get into this technology. It's growing so rapidly, not only in the architectural field, but you read the news. I mean, they're printing parts in the International Space Station when they need parts, the biomedical industry, defense industry. It's impacting so many sectors of our economy that I think now's the right time for us to jump in and to explore and create and to enhance and augment our design process.
Great. And you do, you do about 50 models a year, is that my understanding?
Roughly. Some are quick slap togethers, some take a little bit more time, but
how many hours do you think this will save?
It will, initially it's going to take a learning curve, but I think in terms of having a city staff member making $100,000 a year sitting at his own desk working hours at a time to put something together, it would take 8 to 10 hours, whereas if you send it to print, you're basically doing your other types of assignments while making sure that the print job doesn't fail on you. So there's going to be a learning curve, but over time it's going to save time.
Makes a lot of sense to me, having spent time over the weekend with my third grader and a balsa wood diorama project. I know how long it takes to paste and cut and do all that stuff. And while that's great for a third grade project, for our professional architects, having a printer like this just, to me, makes a heck of a lot of sense. Colleagues, any questions, comments?
I'll talk to your wife and see if we can get one of these approved for the Blumenfield Innovation Fund at home. Happy to support this. It seems common sense. It's a little sad that this is what counts for innovation in the city of LA. This would have been innovative 5 years ago. This wouldn't be innovative anywhere outside of the city of Los Angeles. It would be, well, yes, of course we're doing this. This is more sort of an efficiency fund than an innovation fund. Why in God's name can't you get this funded through the regular budget? That's my only. I'm happy to fund it through this, but it's just.
I think it's too esoteric of an item to purchase. We spent like 18 months just getting a standard 2D plotter after our plotter and scanner broke down. So using the commission to sell the idea, it's an immediate green light, and that's how I envisioned it. I mean, we can go through the traditional procurement process, and we will after the funds are approved, but there will be a greater sense of urgency, all the curiosity type questions of, well, why isn't the cardboard and the cereal boxes not working for you?
Right.
All of those questions would have been fleshed out already. So I think that's why we want to take advantage of this opportunity. And even 5 years from now, these will be standard procurement requests through the budget process.
So the Wi-Fi printer I have at home for my laptop, it wasn't all that expensive. But, man, replacing the print cartridges costs a fortune. What are the costs going to be so that you have the 3D ink to create stuff?
There's, depending upon what system we ultimately get, the materials varies. But the filaments that I purchased for these cost way far less than the standard ink cartridges for your standard color printer. So I think it's going to be very nominal, and it'll just be part of the ongoing expense budgets. Plus, these materials, they last a very long time. So I don't think that's going to be an issue.
I just want to make sure we're not giving you enough money to get the equipment, but not have enough money to use the equipment. So I just want to make sure.
No, the councilman, that would be covered. Mahmoud Karimza, the principal architect, Bureau of Engineering. We have to purchase items like cardboard and some materials to make models. Those are not cheap materials. We still have to pay for them.
Okay.
With this, we probably can even save money in that area as well.
Cool. Thank you.
You know, I was just going to ask the same thing in the sense of, it seemed like such a common sense thing, and I just can't imagine a budget, several $1 million can't find 10,000. And so it just seems strange that we'd be waiting for this long when it's not necessarily, state of the art. It's something that people have been writing about for years now.
Councilman, we have been actually looking at this for years. About 7 years ago, we actually tried a powder-based 3D modeling in our division. Somebody came in and we have given our project and they made a 3D model from the powder, which is very messy. It needs a huge room. It needs a ventilation system, different ventilation system. And also it takes a long time and it creates so much of the powder within that you can get your model out. This is the next generation and it still is in infancy for architectural product. But what we think is this is the right time to get into this now in order to learn it for two reasons. Then when we had the 3D modeling 7 years ago, the BIM was not in place for us. The building information modeling, which transfers the 2D drawing to 3D, not transfers, but makes the 3D modeling and direct to the printer, was not available. So what we had to do was a 2D drawing. We had to make a 3D drawing, and from 3D drawing, send it to the 3D printer. Now the BIM, we work everything on the 3D drawing. So everything is 3D. All we have to send it to the 2D printer or the 3D printer.
Let me just ask, is this something that only one person gets trained and they do it for the whole department? Is this something that multiple people will need access to?
Multiple people.
So is one serve the purpose?
Well, one printer or one person?
But one printer. I mean, that's what we're talking.
As word gets around, other divisions within Bureau of Engineering and other city departments will want to make a procurement. That would be my guess.
That's correct. That's how we looked at it from a commission perspective, that the pilot would result in metrics that we'd be able to determine would save time and money for the city over time. So we'd want to scale that and place that into regular budget proposals in the future.
Yes.
In fact, I just want to add that a lot of our proposals that have come in are sort of what I would call common sense ideas that are not necessarily what we would consider to be innovative in the public sphere, but for the city of Los Angeles, they are.
I think this process may, the things that we wind up funding through the Innovation Fund may be very instructive about how much our budget process itself is in need of innovation.
Yes. Thank you, Councilman.
Okay, so we're going to move forward on this recommendation. I'm going to recommend that we approve the 10,000, the 6,000 for the printer, 4,000 for the training. And thank you both very much.
Thank you.
Next item is number 3. Department of Transportation, Can I Park Here Now? So can we have representatives from the Department of Transportation come to the table, give us a little overview of your proposal? Handouts?
Good afternoon. Ken Husting with LADOT, and I'm joined by Sandip Soni. And we're here to talk about Can I Park Here Now? So I have an interesting duty in my job as being the overseeing division in charge of parking meters, and that is on-street parking. And I don't know about you, but I've received a number of complaints in the city of LA that they don't like to park in our city. Something else is that they frequently complain about is traffic, but what I can do in my current position is at least address the parking. So when I came to the division, we were very much focused on how do we improve customer service with technology. And one of the elements that we frequently heard about and even saw in the media is when you see a 6-foot sign telling you that you could park from this time to this time, but not that time, and then you have to pay at this time, there's passenger loading here. What we're frequently hearing is that this sign is telling me that I shouldn't park here. Or if I do, I'm parking at my own risk. And I've even encountered that situation. So what we tried to do is my team, consisting of Sandip and Armin Kamashayan, has been to look at how do we simplify the signage and how do we incorporate technology to go ahead and improve the overall customer experience in the city of LA. So when you see something that has 6 feet worth of parking restrictions, we want to be able to go ahead and have something, whether it's a red light or a green light letting you know you could park, or if it's something as simple as a text message, a text number that you can go ahead and text and it kicks back and tells you you can park here till this time. So we're looking to not only just incorporate the technology, but also revamp the design of parking signs. Now, I should say there's a distinguishing characteristic with this one over something else that we're working on. Currently, we're working on supplemental design. Supplemental sign is something that it doesn't have regulatory status. That's something that we can go ahead and post up, but you still have to have the existing signage on the post. What we're looking to do with the Innovation Fund is actually change the regulatory signage so that we can go ahead and remove that and condense it and make it more understandable to the average user. So in essence, what we do is just go ahead and revolutionize parking in the city of LA, and as other cities would catch on, they would most likely adopt a similar treatment. And I could easily see this thing going nationwide to go ahead and revolutionize the parking experience. And that's kind of it in a nutshell. We've just one thing I want to add is that we've come up with roughly about a dozen different designs. The one that you're looking at right now is just one concept. We have other concepts, but this one is actually more similar to the existing signs and probably something that's going to be a little bit more appealing to the California Traffic Control Devices Committee. Now, the California Traffic Control Devices Committee, just real briefly, is the regulatory committee for traffic control devices in the state of California. So even though we can come up with the most creative design that we think would work, it still has to go to the committee. Committee has to vote on it and make the formal recommendation to the state for approval. And that's the process that we plan on going through. Like I said, we have a number of ideas. This is just one of them that we're sharing with you now. And with that, I welcome any questions.
Great. So the approvals for the state integration of the technology and the parking sign, walk me through how long does that process take, or what is that?
Okay, so what we're looking to do is actually continue to refine the designs that we have until we feel something that we have comfortable with that we can take to City Council for approval, and then also be able to go ahead and to take to the California Traffic Control Devices Committee. So what we're probably looking is about 3 months to just be able to get it on the Traffic Control Devices Committee agenda, because they only meet quarterly. And then once they may decide to go ahead and vote on it at that meeting and grant us experimentation status, and the experimentation status will likely be about 6 months. And then following that, we would have to report back to the committee with our findings, which would probably take about 3 to 6 months. So we're really looking at probably something between a neighborhood of about 9 to 12 months for this project. And as far as the technology elements, we're working, once we get the innovation funds, we're going to be working on seeing how we can incorporate that into parking signage.
Tell me more about how the technology piece works. I mean, you mentioned the light, you mentioned texting.
Yeah, so we're exploring different ideas. And what I really like, I'm really enthusiastic about this project, is that nobody has done this before in the nation. So this is going to be a first. This is not just innovative for LA, this is innovative for the nation. What we're looking to do is be able to add convenience of, is there a red light or a green light to let the user know, can I park here now? A red light would indicate no, a green light would be yes. Or we may take that a little bit further, and that's, again, just one option we're considering, to where somebody can go ahead and see a text number, they text that number, and it will tell them specifically for that sign whether or not they can park and how long can they park at that location. There's been discussion of using QR codes. There's some issues with using a QR code as far as the height, people able to go ahead and tamper with it, but I think one of the most promising ones is the text message ability.
What did you say, the promising?
Most promising, I believe, is using text messaging. And that's something that I believe most people are familiar with. My mom knows how to text message. She may not know a QR code, but we think that has tremendous potential. And also with different ideas, we have to look at the maintenance aspect. And I think this one actually shows tremendous promise.
And the texting would be in addition to signage, not in lieu of it?
Yes.
So it's like at a supermarket, if you can go to the little scanner at the end of the aisle, but they still have the price somewhere.
Yes. We'd still have to have the signs for law enforcement purposes, for traffic enforcement.
I like the texting thing. I'd be curious if you could send to my office the other versions of this.
Yeah, matter of fact, I think I might have one, which...
This one I still think is a little confusing.
It's
I would not have parked right on this.
Well, we intentionally gave you one of the more complex existing parking restrictions. So that's where the feature like the text messaging, if they're still unclear, it just responds to you immediately saying, you can or cannot park.
I don't think you mentioned Mr. Krikorian's motion, which was about having a grid-style signage.
And that's what I'm going to be handing out to you right now. So that was something that we had already started working on back in December 2013, before the motion was introduced. And so we have refined...
You're suggesting you had an idea before a council member suggested
It's hard to believe. It's hard to believe, but we did move it up in anticipation of the motion. So that's something that you see before you, and that is labeled as option B. And so that grid style we are going to be pursuing, and that's a supplemental sign that I was describing. So the supplemental sign, again, does not have regulatory approval. So in other words, the California Traffic Control Devices Committee did not approve this to go ahead and use it for enforcement. So what we're looking to do is have that, so you're going to have the existing signage that's still going to be posted, and then you'll have the option B down below, which will essentially explain all the signs up above. And it's a very simple grid style or bar graph type of sign that I think most people will find very convenient. And we're looking to do that as a pilot program, as Councilmember Bonin mentioned with Krikorian's motion.
Yeah, the grid stuff looks nice. If you're doing a pilot on that, you're going to do it in Mr. Krikorian's district, I hope?
We are looking at some of the most complex parking.
Just Venice again.
No, Mr. Krikorian made the motion, so I was actually suggesting his area.
That's one of the areas that we would be looking to go ahead and expand it to.
Thank you.
Sure.
Mr. Parks, do you have any additional questions? Great. So this is very exciting. I'm going to recommend that we instruct LADOT to continue to move forward with this, and also to make sure that they're sort of we could move forward with the texting piece, even if the other piece gets slowed down by the state bureaucratic process.
It is something that we can pursue, and if for some reason, again, the state committee does have the ability to go ahead and say yes or no to whatever we propose. So there would be at least something that we can salvage from the project, as you mentioned, the texting ability.
Right. So the recommendation is going to be to approve this, but to make sure that it's also able to be moved forward, even if with the texting portion, even if the other portion gets slowed down by factors out of our control. Great.
Thank you very much.
Next, we have item 4, the City Controller, MyPay LA. And I want to invite the idea proposer for this forward from the Controller's Office and the Implementing Department representative from ITA to the table. And please go ahead and give us an overview.
Thank you very much. I'm Claire Bartels, Chief Deputy Controller for Controller Ron Galprin. Before I commence the presentation here. I just want to say, as a long-term city employee and a resident of Los Angeles, I have observed, just sitting in the audience here for listening to the 4 presentations that have preceded me, that what I find most rewarding and most exciting about this is the level of enthusiasm that the employees have demonstrated in their presentation of these projects. I just don't see that every day, and I think a lot of credit is due to the creation of this whole concept. So thank you. I can also assure you that Controller Galperin is no less excited, in fact, maybe even more so excited about this opportunity. And so thank you very much again for letting us share with you our innovation application, which, as you said, is would like to call MyPay LA, a mobile payroll viewing application. It's the controller's vision in everything that we do to try and leverage technology wherever possible to achieve efficiencies, cost savings, and other benefits to the city. MyPay LA does exactly that, or will do exactly that. As you know, the controller makes payroll, issues pay to city employees on a biweekly basis, and the good news is 90% of our city employees are now on direct deposit. That's actually above industry standards for direct deposit, a very good thing. However, they can only access as you probably know yourselves, can only access your information by logging onto a city computer, intended with the best of intentions to keep private and secure the information, but it does mean that people have to do it at work. The alternative to getting information is a printed paper copy, not very environmentally friendly. And in fact, we still print about 250,000 paper remittance advice to those on direct deposit annually. So quite a lot of paper is being utilized. Excuse me. So an interesting statistic, as you know, we administer the payroll system, or the business owner with our partners here at ITA who run the system. We have observed that nearly 1 million times a year, a good portion of our city population is logging on to our city system and spending, we estimate, a good 3 to 5 minutes each time viewing whatever aspects of their pay, their leave balance, their gross pay, whatever, sending themselves printing copies or sending themselves their information. This amounts to, we estimate, the cost of time and energy wasted is in excess of about $1 million a year based on having to do so at work, and obviously it's a productivity loss. For people who work in the field and they don't have ready access to city computers, the process is even more cumbersome and time-consuming. And we can assume people do need access, and they are finding their way to city facilities, perhaps when they can be otherwise employed or deployed. This proposed project will deliver payroll information to employees at their fingertips, anytime, anywhere. I know most of us carry some sort of mobile device, whether it's an iPad or telephone. Mine is, thank you, demonstration, Ted. Here, we expect we'll be able to enhance customer service to our customers, all city employees, and most importantly, we know that this platform will be the foundation for the future. Right now, it's just about looking things up and reviewing your information, but down the road, it'll be an opportunity to interact and make changes to your choices of that which you have to do manually by walking into the city controller's office today. So in this day and age, when mobile devices and their usage is an integral part of our daily lives, the controller is very excited to partner with the council, the mayor, the Innovation Fund partners to deliver what we believe will be an opportunity to not only meet but exceed expectations and increase productivity. Details, questions, we're happy to answer.
Great. Sounds very exciting. And how fast can it happen? If you get the funding, when could we get it implemented?
By year's end, by fiscal year end, we estimate 120 days at the outside. So you say go, we are ready to roll.
Right. And then ITA is there a cost that ITA is absorbing in this?
Yes, absolutely. So the platform we're using is called the Capriza platform. So we're actually leveraging existing programmers on our payroll system to create an HTML5 mobile web version. We use vendor hosting for it. That's the part of the cost associated with it. It's secure, 256-bit encryption, and our take on it is, as the council members know, we don't like to come up and ask for money or hardware if we don't need to. For a situation like this, it has an ongoing vendor cost, but there's no cost associated with our programmers. We're going to develop and manage it and support it ourselves.
And if the app is a success, which department would ultimately take ownership and include that small ongoing cost in their budget request?
We would expect to be the department measuring the effectiveness of this a pilot project. We would measure that effectiveness both in terms of the number of people who download the application and use it, and the diminished number of minutes and ultimately hours spent on presumably city time looking on the city computer. So we think the project will actually pay for itself. We would therefore be bringing it forward for conversation, perhaps funding it in the controller will make the approach, but we think it might be appropriate for funding on a citywide basis in the future.
Colin?
Thank you. The current system is a nightmare. I appreciate it.
I must say, I had no idea that many people would be looking at their pay stubs on an annual basis. It's amazing to me.
It is. It is quite amazing.
I mean, the thing, because it's a fairly consistent document that says how much you make and how much they take out. What is your sense of what the interest in looking at it? Is this hoping it's bigger or what?
I couldn't actually say exactly what their interest is, but as you can see on your remittance, some people make adjustments to their withholdings regularly. Some people, there's overtime hours, temporary bonus pay, perhaps. There are quite a few variations in various people's pay that
vacation accrual
does vary. Certainly leave balances, sick time balances, quite a lot.
Thank you.
You're welcome.
Those would be the big ones, probably. Well, great. This is, I think it's a great idea. I like your enthusiasm, and I like the fact that you pointed out that that is another real benefit of this, is that we do have enthusiasm among the employees of LA, and that's good for the city across the board, beyond the efficiencies that we see in all these programs. So it's going to be my recommendation that we move this one forward and for full approval as well. And we'll move on to the next item. So thank you.
Thank you.
Okay, number 5 is Personnel Department One-Stop Shop for City Workforce Candidates. I'd like to invite Todd Sargent, IPC President, to the table, and a representative from Personnel to the table.
Hi.
I can get started. So actually, this was a proposal that came...
I'm going to invite you to the table.
I'm already here. It came from discussions with from across the various departments, and essentially what it does is modernize or upgrade the current personnel website to include classifications beyond full-time equivalent and part-time. So it would include classifications such as interns, volunteers, apprentices, commissioners. So a lot of different... To be fully honest, as a commissioner, I've been a commissioner now a year and a half, but there's no real great way to figure out if there are opportunities within the city from a commission perspective. And then, of course, we started looking at, what if you want to be a volunteer within the city? Well, you've got to go to each one of their individual websites for the various departments and do some research, and it's not always easy to find. And so the information's out there, it's just not centralized. And so what we discussed with the personnel department is, again, adding those classifications to the central personnel site for recruitment, and have them as a one-stop shop for city workforce candidates.
Gloria Sosa, Personnel Department. Basically, the funding would allow us to enhance our website in that it's important, whatever information that we maintain on the website, whether it's volunteers or internships, that it's easy to be updated and posted and removed, which has been an issue for us in the past. What we would look to use this funding for is to program the website to enable departments to directly access our website and post the information about their opportunities. As Todd mentioned, someone who is interested in a student internship type program or a volunteer program wants to do some good for the city as a public servant in any capacity is often frustrated because they have to look for where can I find out about commission appointments or what have you. And by coming, and we have people that call the personnel department, I would like to work for this department, Rec and Parks, on a part-time basis. How do I know about that opportunity? Well, it is difficult and frustrating for them to navigate the city website. By putting all of these opportunities, we would be able to attract a great deal of people to the city in a variety of capacities, and even more so, again, as they come to the city, they'll also look at our regular civil service applicant opportunities, and we're recently started working in our social media. We're on Facebook, Instagram, LinkedIn, Twitter. All of those opportunities would then also be posted to all of our social media. And it's very important for the city to become not only the employer of choice, but the place to be associated with, to work and play in and be able to volunteer. And we see this as a great opportunity. We also will be updating our website overall, so this just dovetails in perfectly. So we're looking forward to doing this.
Seems like a great idea, and I love the idea of attracting more volunteers and interns and energy into this city. I mean, for lots of reasons. One is that we have a very aging workforce, and
absolutely
we need to do something to attract young people, and sometimes the best employees are the ones who started out as volunteers or as interns, and so this is great in my book. How are we going to be able to move it forward in terms of timeline? How fast can it happen once you get the funding?
Well, we're looking at using programmer analyst contractual services that we already have in place, and be able to, as soon as we work with departments as far as a design on what the template will be, we'll be able to, as soon as the programming is completed, which we would expect would be maybe 3 months at most.
That's great. Colleagues? Great. Well, then I'm going to recommend the $25,000 full funding for this, and we'll move on to the next one. Thank you. Great idea.
Thank you. 25 or 35?
This one is, I have it down as 25. Is it 35?
35.
35.
It's 25 for the resource time and the 10,000 for the process activity. So developer versus process time.
Great. Thank you.
35 total.
Thank you for spotting that. So I'm going to recommend the full 35,000. Yeah. My mistake on that. The next one is the DWP automated inspection units. I'd like to invite Michael Saylor, the applicant, to the table, as well as the DWP representative. Please come see. I had a chance to talk to Mr. Saylor a little bit beforehand, and I think it's a great story how you came up with this. So I'd love it if you could start us out. Just tell us a little bit about the inspection work at Castaic, what you do and how you came up with this idea.
Okay, well, my name is Michael Saylor, and I work as an electric mechanic at the Castaic Power Plant. So we take care of all the maintenance up there. And one of the jobs that we get involved in sometimes is doing what they call the penstock inspections, which we have to walk about a half a mile of pipe, 13-inch diameter pipe, and inspect it for cracks, breaks, pedestals that it's mounted on. And the hazards that we have is we have weeds, we have drainage ditches, and we have a steep incline, almost 30 degrees, that we have to walk down. So we have to have proper protective equipment. Also, that the fact that there's rattlesnakes are now this time of the season. Last week we've had 2 people almost get bit by the rattlesnakes when they started the walk. So they had to stop and plan it for another day. So my idea of these unmanned aerial vehicles, I don't like drones because it sounds too military, but we could fly those up the penstock, take actual footage of the video, and then that can be brought back to the engineer, or he could actually watch it live on a screen. and see it firsthand. And he could say, stop, I want to look over here, turn the camera this way, turn it that way, zoom, whatever. And then he can make a determination as to whether repairs need to be done or what has to be done in the future.
That's great. I mean, once you have that idea, it makes so much sense as you think about it. It's one of those ideas that's sort of the aha moment, the light bulb goes off, and you say, wow, it's so easy to see how this could be, save so much energy and time and rattlesnake bites, and not only give you that visual inspection, but in some ways give you a better inspection. You can hover that, UAV right over the crack. You can look into it. You could even down the road get an infrared, camera on it, or all sorts of things. We are being joined by Nuri Martinez, who's the chair of the Audits Committee in this joint committee hearing. So I wanted to recognize that for the record. Thank you, Ms. Martinez. I know, as we mentioned, she's caught up in the other hearing. So I love the idea and really appreciate the fact that you this is a great idea. You were out on the job and heard about this and then thought about how you could make this work better. So it's great. Now, wanted to mention the DWP, if management has looked at this and what management feels about it. Are you supporting it?
Yeah, my name is Kenneth Silver. I'm the Director of Power Supply Operations for Department of Water and Power. I actually just became aware of this idea this morning, but as you said, it's why haven't we already been doing this? The savings in the increase in productivity, improved safety, and better records, it just seems to make so much sense that I fully support this, and I see we're only scratching the surface. There's probably many more applications we'll discover once we get this technology available to us.
Great. That's a great example when you have folks on the line doing the work, coming up with the innovations, you get these kind of great innovations. Colleagues, any other questions about this? Mr. Parks.
Yeah, I had one question, is that I would just ask as you go through this until we work out all the details that you look at renting versus purchasing, so we don't have a stockpile of materials and equipment that get outdated or we find something else on the horizon, and also until we can work out all of the details. So that would be my suggestion, that we rent as opposed to purchase until we figure it out. The other thing I was wondering, is there any danger in the sense of flying or striking something like the electrical, or is that what we're dealing with, the electrical poles?
They could, but I don't believe they would fly it on high voltage lines.
So they'd be only certain it wouldn't be high voltage?
No.
Okay,
No.
I got it, all right.
Having flown one of these myself, I don't know if we're supposed to or not, but I got to play with one, and it's amazing how, you would have a licensed person who actually learns how to do it, but even someone like myself, a layperson, is able to pretty easily start doing it right away, and they're remarkably accurate in terms of where they move. And, you can move it with a lot of precision. And the recommendation before us is $5,000 for funding to rent or purchase up to 3 experimental units. So it's covered in that, and as the department figures out the best way financially, they're not that expensive as you go to Sharper Image and even buy them, but you can buy them, a more industrial version obviously would be a little more expensive. But that we leave up to being considered. Any additional questions? Or we're going to recommend funding of this item, and want to thank you both, and Mr. Saylor especially, thank you for coming forward and with this, and just a great idea. And
Well, thank you. Thank you for your time.
Thank you.
okay, as we took number 7 out of order already, and so we're going to move to our last piece on this, which is item 8, and I'd like to invite a representative from the Bureau of Sanitation to the table for an overview of their proposal.
I should note from the start that this was submitted from an employee, and the cost estimate was based off of information we had at the moment. So we might have additional information here at the table.
Yeah, we're going to go to that. This one is a little confusing on the cost and where it doesn't seem to add up yet. So maybe we'll hear. It may or may not be fully cooked. I don't know. So go ahead with the proposal.
Thank you. Bob Irvin. I'm the Director of Systems with Bureau of Sanitation. And I guess I'm representing the person who put the idea in, as well as the department position on this. But right now, the residents in the city, if they have extra refuse capacity that doesn't fit in the container, they have the ability to buy extra capacity tags. And these are on sale at the district yards that are around the city. So the resident has to go to the yard, and they buy these in groups, I think, of 10 or 15. They're $2 each. And then when they have extra trash, they put it in bags, put the tag on, and then when the refuse collection drivers come around to pick up the regular trash, they know this has been paid for, and they go ahead and dump the container and then put this in and dump it again. I understand having a resident go to the yard to pick this up is kind of horse and buggy in this day and age. And that was the suggestion, that we set up a system to allow residents to purchase these tags online and to print them much the same way everyone prints boarding passes for airlines and things like that. The department agrees this is a great idea. Our recommendation is, though, and this is probably where it gets confusing in our response, I think you're probably looking at the spreadsheet we put together. Our recommendation is that the online portion of this be done as part of the 311 system that's due to go online here fairly shortly, late May, June, thereabouts. We set it up as an additional capability of 311, and also build in the capability to do the monetary transactions. That'll probably not be handled specifically by 311, but we would work with the finance department to use one of the vendors that provide credit card processing. The other, excuse me, the other issue we'd have to figure out is how best to handle the tagging. The idea of printing tags, sanitation has some concerns about, because the drivers don't have any way to authenticate these tags. They don't have barcoding equipment with them, or any other way of authenticating or validating that this is a valid tag. And the other concern we have is if it's just printed 8.5 by 11 piece of paper, and they stick that on the bags, they could easily blow off and create trash blowing around the neighborhood or something. So we're going to evaluate alternatives for doing this online and providing tags to the residents. We could mail the tags. It's possible we could even do this by exception. This happens infrequently enough. I think there was only 6,000 of these sold last year. So it's infrequent enough that drivers could potentially just be given something as simple as a piece of paper saying this address has extra capacity, go ahead and take care of it. But this is something that we would evaluate as part of moving this into the 311 system. And again, our recommendation is that this be done post go live for 311, and it be done as a modification to the 311 system. Any questions?
Well, frankly, I'm not sure what we're buying for $25,000. I mean, if it's just on the surface, there's 6,000 of these calls a year, $2 a tag. That's, people are paying $12,000, so we're paying $25,000 for a $12,000. I'd rather just cut the price in half, $12,000, and pick up it for free, and not bother with any of this. Then we're spending $12,000, and we're providing a free service and avoiding a lot of bureaucracy. So it doesn't make sense to me to spend, and not that $25,000 is a lot of money. It doesn't make sense that we're doing the old horse and buggy system. I agree 100%. We should be doing things online. I totally agree we should do something through the 311 system, having people being able to, at the very least, request the additional service and pay for it, or if they need to. But really, 6,000 of these a year, we should just do it for free and not pay anything. And,
yeah.
But I don't know. I don't think this is cooked fully. My recommendation at the moment, I'll have my colleagues weigh in, is we should put this one off for a little bit. Not that it's a bad idea, it's a good idea, but have the department look at it, maybe cook a little more, see if there's a way to do something, even something as simple through the 311 system as making the request for the additional bags, whether it costs or it may be more expensive to set up the payment system than it is to just do it for free, or if the payment system can be piggybacked onto an existing credit card payment system that we have, we can do that, and then, as you say, just have the drivers be notified of where the extra piece is. But I don't know, it just doesn't feel cooked to me, but I defer to my chair, co-chair.
Thank you. I apologize for being late. We just adjourned our Economic Development Committee. And thank you, Mr. Parks, for stepping in. I had a couple of questions. Why is the Bureau including the printing and the mailing cost as an additional cost to this idea? Wasn't the original intent to let the public print the tags at home?
The suggestion was that the public print the tags at home originally, just like a boarding pass is printed. There's a couple of concerns sanitation has with that. One is we don't have any way for the drivers to authenticate that the tag is valid rather than just a copy, because they don't.
The idea is to move away from the intent of allowing the resident to print his or her own tag. Now we're going back to the department doing it? Is that why you added the additional?
Right.
Mailing costs?
Yeah. The initial recommendation, we had to come up with recommendations associated with this fairly quickly, and I appreciate Councilmember Blumenfield's suggestion that we give this more study, because that's our recommendation too. There's a number of ways this could be accomplished. But at the outset, our recommendation that we put in here initially was to continue to print heavier cardboard tags that had twist ties on them, which is what we're currently using, and that kind of eliminates the concern about loose paper blowing around because they're a little more rigid, and the drivers, they're going to be harder to counterfeit, so the drivers will know that they're valid if we continue to use tags at all. But that's part of, I think, what we need to assess. The other thing, a couple of things I did need to make clear that I didn't up front. Our estimation isn't that we could do this for $25,000. We expect it would be more than that. Modifying 311 and putting online credit card processing in place, we're swagging it that it's probably going to be in the neighborhood of $150,000 plus some ongoing costs. The other thing that the committee needs to be aware of too, this extra capacity process is covered by an existing city ordinance, section 66.48. So whatever we do, the ordinance would have to be modified to accommodate properly any changes we put in the procedure as well.
The other question I had, so what salary costs are you associating with implementing this idea?
Just the salaries, ongoing salaries of
the people who would be working on this?
Yeah.
Do you have a figure? Like, well, how many people are we talking about?
I think it's a quarter of an FTE, and that may be high. Again, we just put this together quickly. There wasn't a lot of analysis done on specifically what's going to be involved to support this on an ongoing basis. So,
shouldn't it be noted, though, that there are employees that do this today? There are manual people sitting in the divisional offices doing this.
Good point.
Seems like. I'm sorry. Go ahead.
I'm sorry. Does the Bureau know approximately how many tags it utilizes every year?
6,000 last year. So it's not a high number. When you compare that to the number of service requests we handle, we handle tens of thousands per month. This is a very small number in contrast to that.
Currently, how does the Bureau track how many tags are purchased per household every year? Currently, what's the system?
I'm not sure we do it by household. We sell the tags, and since there's cash involved in the transaction too, we keep track of that. The administration group in the solid side of the Bureau of Sanitation handles that. It's a relatively manual process.
Okay. So whatever we do with this new idea, I would hope that would improve the tracking process, right?
That would be another reason to put it into 311, because one of the benefits of 311 is you've got a unified database and management system for all service requests for the city. So this would just be one of a number of service requests that would be handled for sanitation and other departments.
Can I suggest that perhaps this item go back
Yeah,
to IFC and further review, and then bring it back?
I completely agree with that. But, I mean, just listening to the innovation to me would be to just ditch the whole cards entirely. 6,000 of these requests a year, $2 a year, $2 a one, that's $12,000 versus $150,000 to develop a system and ongoing cost. I'm making a recommendation to the IFC that they look at not only this, but more innovatively, getting rid of tags entirely, saying that from now on we pick up the extra bags for free. Because the other cost to this is for the people who don't go through the pain to go buy a tag and go somewhere and pick it up. Very few people. What do they do with it? They dump it in the alleyway.
That's right.
And that costs us 10 times as much because we have to go clean the alleys and everything else. And they don't. The reason why they dump it there is because they know that they don't have the tag or it's too much of a pain. If the law of the land was if your can's full, you just leave it next to the can and the guy picks it up, we might have cleaner alleyways. So to me, that's
For the commission, the main point was access, that we wanted to provide much more availability for excess capacity, and we wanted to be able to collect those as quickly as possible and make it as easy for our Angelinos to do that. So we'll take that recommendation and go back to the commission.
And I love all the online stuff. I'm a techie. I mean, anytime you can do that, but I guess even more than living online, I like just
make it easy
and free and, no more bureaucracy. So.
Yep.
The two chairs agree on the recommendation, which is to send it back, let it get cooked, but also adding in the provision of let's look into the innovation of just scrapping altogether tags and just having that become a city basic service.
And then having it cost $150,000.
Right. It would cost $12,000 a year, and probably less because the $12,000 a year is the $2. So the cost of that has to not only cover the picking up of the trash cans, but the making of the tags, and probably the actual cost to the city of picking up the extra bags is probably half or less than half. It's probably $2,000 to pick up those extra bags. And so it's crazy to me that we don't do that. So we should do that, or we should make a motion to do that, or something like that. But we can have the innovation. I don't know if that's considered an innovation fund if it doesn't cost any money.
It's not. Actually, we would refer that back to sanitation for implementation.
Yeah, so maybe we can make it.
But we can work together.
Bring us back something with the cost of $1 to print up the ordinance that says no more tax. Okay, so with that, colleagues.
But one of the innovations is you eliminate this counterfeit ring that's going to come about in the community. That's a joke. I was just.
Oh.
You got serious real quick.
So we've gone through all the items. Mr. Villanueva, do you want to summarize? Because we had, you don't have to necessarily, but we had some where we're increasing the funding slightly, and so we need one vote actually of the committee to.
Councilman, sorry, if I may, the CAO has a companion report to the Commission's report that has several recommendations that include implementation details for some of these ideas, including asking the Personnel Department to create the classification for the nurse practitioner so that the Fire Department can implement the nurse practitioner response unit, creating accounts within the Innovation Fund for these ideas, and then transferring money to the departments for implementation purposes. And we would be happy to work with the two departments where the amounts have changed and provide that information to the city clerk to reflect the actions, assuming you agree and vote on them right now.
Okay, very well.
Last thing is we also had recommendations asking the departments to report to the commission with not just an accounting of the funds if they've spent them, but also the lessons learned and any obstacles that they faced in implementing these ideas. I don't know if you wanted to add information to that report back, and then asking the commission to report back to the council on a regular basis on the status of the program and lessons learned and recommendations for any changes to the structure of the pilot program in the future.
All good additions without objection to be added in?
Yes.
Mr. Villanueva?
Yes, sir. So the recommendations is to adopt the CEO recommendation with the following amendments. Increase the LAPD funding from 50,000 to 60,000 and not include the Bureau of Sanitation extra capacity tag online, the 25, the last recommendation, and amend the CEO recommendation number 3 to decrease the transfer amount from 312 to 287,000. That's on the first attachment of the report, and to reflect the reduction associated with the Bureau of Sanitation extra capacity tag online automation item, and adopt CEO recommendation numbers 2 and 4 and 9, and repair the Bureau of Sanitation extra capacity tag online automation item back to the Innovation and Performance Commission for reconsideration of the cost and scope, and instruct LADOT to continue to move forward with a texting and mobile web feature as part of supplemental parking signage, even though proposed changes to regulatory parking signage may not be approved by the state, and instruct implementing city departments to report back on the status of the projects.
Did you include the fire department one in there?
That was an increase. The LAPD additional consideration increase LA fire department funding from 147,000 to 245,000, so the pilot can operate for a full year.
Great, thank you. And do we have to take this as two committee votes, or can it be one vote?
It's a two-committee vote, so we can.
So let the record reflect that of the Innovation Committee, majority of the committee members have voted for it, myself, Mr. Bonin, and for the Audits Committee, it was unanimous.
Perfect.
Assuming without objection.
Yes, sir.
Great.
Yes, sir.
So this meeting is now adjourned. Thank you all.